Might help if my video is on. Right. Welcome, everyone. Hello. Thank you for attending this meeting of the Oversight and Engagement Board public meeting on the 4th of September, and it's approximately 10:16. Thank you very much for everyone attending. I'm going to go straight to the papers. So we've got item 10, which is the minutes from the previous meeting of the 27th of August for the public session. I'll assume, unless anyone's got any burning desires to comment, that is as read and that we can sign those off. Thank you very much. Thank you. Item number 11, the summary of the local surveillance data, and it's over to Lucy Whiteman, our Director of Public Health. Hi, Lucy. Thank you.
Good morning. Thank you, Councillor. So apologies, obviously the delay in our meeting this week has meant that we've got last week's data pack and a new one will be coming out this afternoon. So last week's data pack obviously includes data up to the 23rd on the most part. If it's different, I'll point that out to you. But obviously we know that there's been an increasing number of cases in Northampton, Corby, Kettering and Wellingborough, and therefore people have been being asked to follow additional restrictions. Northampton continues to be an area of intervention, and obviously certain Green Corps employees and their household contacts had been ordered by the Secretary of State to self-isolate for 14 days up until close of play today, in actual fact. So from a point of view of incidents, Northamptonshire continues to be an area that is statistically significantly higher than both the regional and the national average per 100,000 population. And the incidents in Northampton town, obviously being, or borough, the area of current intervention, is now down to 37.8 per 100,000 and has significantly dropped even further since then, in actual fact. So as we know, Green Corps factory closed voluntarily for 2 days and undertook a deep clean and reopened with a phased return of staff for those that either had been furloughed previously or either finishing their self-isolation period from a previous positive test. And then obviously we'll be back open to full working capacity as of tomorrow. There have been no further cases in the Green Corps staff, and obviously Green Corps management continue to work very closely with us. There's another outbreak management control meeting today just to make sure that any loose ends, etc., are tied up before the full reopening of those premises. So from a point of view of those key messages, they remain that we're asking for people to act now, particularly in light of the escalating situation in Kettering and Corby, to remain 2 meters apart at all times wherever possible, to limit contact with anyone outside of their household or their bubble. And if you do need to meet people outside of your household or bubble, to always try to do so in an outdoor space where you can't, obviously, to use a face covering. Not to share items outside of your household or your support bubble, to avoid using public transport where possible, or if you need to do so, or to car share, to do so with face mask coverings throughout the journey. Obviously to continue some of those basic hand hygiene practices around washing your hands frequently for at least 20 seconds. And for those that can, to continue to work from home, particularly in those heavily affected areas. From a point of view of the weekly summary of cases, from the 17th to the 23rd of August, there were another 161 cases identified, taking the total for Northamptonshire to 4,235. 39 of those cases in that week were identified through Pillar 1 testing, so care home testing, high-risk staff, in hospital and clinical care settings and patient testing, and then 122 of those cases were identified through the normal testing routes in the community and home testing kits. Overall, the demographic continues to be primarily that working age group, slightly more predominantly female than male, but that could be to do with more active health-seeking behaviours. Women tend to attend for testing more readily than men do, so making sure that obviously men also attend whenever they have any concerns. From a point of view of our actual cases by borough and district, a greatest number of cases in the last week up until the 23rd of August was again in Northampton, again most populous area, so no surprise there. but the numbers in Corby and in Kettering creeping up. South Northamptonshire did see an increase in that week, but still only had 6 cases, so still low numbers from that area. But Corby and Kettering of particular concern, with 17 cases in that week in Corby and 25 in Kettering. So to make that more comparable, obviously we've got a rate per 100,000, but this is cumulatively since the beginning of the pandemic. We do still continue to have Northampton and Kettering as the statistically significantly higher areas in relation to that. And cumulatively in each district, we know that obviously again, Kettering, Northampton and Corby are the areas that have had the highest number of cumulative cases since the beginning of the pandemic at the end of February. From a point of view of a rate of daily confirmed cases, again, we've seen a significant spike, but an equally significant decrease in Northampton, so associated with those cases at Greencore. Similarly, there was a small increase that equally dropped in Wellingborough because we had a number of employees who worked in that area. But in the last few days, so coming outside slightly of this reporting area, we've seen that significant increase in Corby and a steady increase as has continued for the last few weeks in Kettering. From a point of view of our outbreaks, we've got 22 active outbreaks currently within the county. 10 of those are within care homes. Now, obviously, I always caveat that with the fact that we are proactively testing care home residents and staff. So these are very small numbers in each of those outbreaks. We remember the definition being 2 cases linked by place or time within a setting. But we have had an increase in the number of workplace outbreaks. Now, we continue to obviously work with our employers, our environmental health officers and the health and safety executive to ensure that risk assessments and good practice are in place. But as we see more people returning to work, this is likely to be a significant factor in our future reports. At the moment, the number of cases associated with those outbreaks is 321, but that obviously the lion's share of that is the Greencore staff. So therefore you can see that although there are another 8 outbreaks in workplaces, the numbers associated with those again are very small. We are seeing an increase in the number of active exposures. So these are single cases where there has been or potentially has been exposure to contacts within that setting. So quite often an exposure would be considered where somebody who worked in a public facing service became positive, because if they worked during the period in the run up to their positive diagnosis, they may well have infected people that they provided a service to. So we've seen exposures such as those in pubs, in bars, in coffee shops and care facilities. So we're making sure that obviously we monitor those situations very closely and are looking to link any further cases that we may find in the area with those exposures so that we can declare an outbreak and follow up as required if necessary. So our ongoing actions obviously continue to be to engage with all of our major employers, with our nighttime economy providers, with the public in general, to make sure that they understand the importance of acting if and when they do suspect they may have been exposed to COVID, if they develop symptoms, making sure they isolate as soon as possible and seek testing. And most importantly, if they're diagnosed as positive, that they and all of their contacts, as identified through test and trace, do self-isolate, because without that, breaking that onward chain of transmission, we'll continue to see numbers locally go up, and subsequently we are likely to see levels of intervention go up as well.
Thank you very much, Lucy, for that. We've got item number 12, which is the situation update. I feel you may have covered a fair bit of that in the last section, but if you want to give a specific situation update, then that would be gratefully received. Thank you, Lucy.
So I think what I would say is that, you know, this week's data pack will see a significant change in the situation, particularly in Corby. As I said, we've been monitoring Corby and Kettering for quite some time, and the team have been working with the environmental health officers and communications officers within those areas for quite some time, having seen an increase in cases. That's been quite a slow, insidious creep, but in the last week we've seen a significant spike in the numbers in Corby in particular. So we're going through the test and trace process, and we're able to put out information about what's happening in those particular areas. So we've got an understanding of what's driving it, and it is a slightly different demographic to the ones that we've seen affected. The numbers are of people affected are getting younger, and therefore we're looking at how we tailor our approaches and our communications to ensure people understand what they need to do should they, as I said, either suspect that they have COVID or indeed get a positive diagnosis, so that we can ensure that our numbers obviously start to change and start to reduce. So we need to stop that onward transmission.
Thank you, Lucy. Very, very important information contained in there. I'm seeing if anyone's got any questions. It doesn't appear that there are any, in which case item 13 is a testing update with a testing strategy and venue update, which I believe you're covering as well, Lucy. Sharon is not able to join us today. So over to you again, Lucy. Thank you, Lucy.
Apologies from Sharon, she was pulled away this morning. As I said, I won't do as good a job as she will, but what I can obviously provide is an update. We now have those local testing sites up and running successfully in Kettering, Corby, Wellingborough and Northampton. We're seeing really, really good numbers go through, and I'm really pleased to report that obviously we've had the top 5, 3 or 4 of the places in the top 5 for the last 2 weeks have been taken up by testing rates locally. So Corby at the moment has the highest testing rate in the country, followed by Kettering at number 3 nationally, and Northampton at number 4 this week. So really impressive response from a point of view of our call to action for people to get tested if they're at all concerned. We need to see that continue so that we understand where COVID is hiding, and we can obviously get on top of that continued transmission in the community. We do still have 2 mobile testing units. So one of them at the moment is still rotating around all of our industrial estates so that we're able to provide testing in a really accessible way to those high risk settings, those workplace settings. And the second is moving shortly from East Northamptonshire through down to Barton Seagrave and Elsbarton. I was going to say, that's not right, is it? Elsbarton. So that we can make sure that we're providing additional support to the Kettering area.
Say Burton Latimer. I thought
Burton Latimer. Thank you very much, Russell. Went completely out of my head. So Burton Latimer, which is one of the high prevalence areas in Kettering. We are obviously at a point where we're trying to get the final plans through for the regional testing site in Kettering. And again, if we can get that established, that will also provide a longer working day for the mobile testing unit. So we've been pressing the provider to make sure that we can get that set up in light as well of our increased cases in both Kettering and Corby. But really good news from a point of view of access to testing, and wanted to say thank you to everybody who's enabled those testing sites to be established, but also to the public for obviously accessing those as and when they have concerns. It's really helping us identify the cases where they exist.
Thank you very much, Lucy, and I would agree with that. The mobilisation of the teams around this has been mightily impressive, and I have to say, nationally recognised as well, to be fair. So yes, we are seeing increases in numbers, but it is largely down to the testing that we've been doing. I've got a number of hands up. So I've got Chris Stamborough, then I've got Toby Sanders. So if we go with you first, Chris. Thank you
very much, Ian. And I just wanted to say, I think I heard Lucy right, that Corby has the highest rate of testing in the country, which you have to say is absolutely fantastic news. And that's a league table that Corby should be really proud of being at the top of. And the message to the people of Corby has got to be, keep getting tested. There may be other publicity around number of cases, but if people don't go and get tested when the testing facilities are there, then that's the wrong thing to do. So I've got to say, well done, people of Corby, and keep getting tested, and I hope they will do so. Thank you, Ian.
Thank you, Chris. Yes, I completely agree with that. The worst case scenario would be people not being tested and the numbers starting to drop. If anything, we need to keep that position at the top of that league table. Toby, over to you.
Thanks, Ian. Lucy, over the last couple of days, there's been quite a bit of coverage nationally in the media and on social media with stories of people in other parts of the country having particularly long journeys to get to testing. And I think that's starting to perhaps put some people off from doing exactly what Chris has quite rightly just reminded us all, which is the importance of being tested if people feel they have symptoms. I'm not picking anything up from a local point of view that's impacting on Northamptonshire, and I think particularly as an area of focus nationally, we've been really well supported in terms of level of testing capacity. But I just wanted to check with you that was still your understanding as well, that locally residents and our local population in Northamptonshire have got the access that they need to the testing locally without the need to be put off by some of those long journeys that have been reported elsewhere. Thank you.
Yes, that's a very good question, Lucy. I think that I have to say that coverage has been slightly unhelpful, I suspect, in some regards. But anyway, Lucy, I'll leave you to answer that.
So thank you, Toby. I do recognise, obviously, that's a significant concern. We have spoken to our regional convener on this regard, and we've been assured that because Northampton is a current area of intervention, and with the significant increase in Kettering and Corby, that we will continue to be prioritised from a point of view of testing capacity. So we're fortunate not only to have 6 sites at the moment, obviously 2 of which are mobile, 4 of which are static, but also to have that sort of guarantee from government that whilst we continue to be an area of high incidence, that we will get access to that testing capacity in as much as we need.
Yes, thank you. That's really good clarification there, because as you say, it's likely to be areas that haven't had so much focus and attention on them in many ways. So I've got another question from David Jones. Hello, David.
Thank you. Yes, speaking from Healthwatch, a public body that is speaking for people who use health and social care services. Really good news about the testing and about the trend in figures. And one of the things I think all of us have been discussing is the fact that people are getting frustrated by the limitations, and particularly young people who want to get out and socialise. We want to emphasise the fact that we want to help people live their lives safely and effectively, rather than stopping people doing everything. But one of the consequences of living your life in this COVID era is that testing is so important. We want to give people advice, and perhaps we'll hear about that later on, about how you can live a life that is open and develops friendships and has communications, particularly for young people. That is so important. But if that is going to happen, then testing becomes even more important, that people know. And we've seen that in other areas of social life as well. Testing for other things is also important. So the message must be testing is important, but we want to help you live your life safely. And remember that testing helps you to keep safe, not only you, but your friends and relatives as well. Thanks.
Thank you, David, for that. That was a very good observation. I've got Jean Addison. Hello, Jean. Hi.
Thank you, Chair. Again, about testing, I think people are quite confused, people that I speak to. You know, the message is if you've got symptoms, go and be tested, but we do know that people are walking around asymptomatically. So what would be the advice for people, for the general public?
Thank you, Jean. Lucy.
So at the moment, national policy is that you should only be tested if you're symptomatic. Locally, because of the situation, we changed that narrative a number of weeks ago, and all of our advertising, all of our campaigns have been, if you're concerned at all or develop symptoms, that you get testing. And obviously those messages have really resonated with people, and we've seen clearly the access to testing increase as a result of that. As I said, we can't actively encourage everybody at the moment to be proactively testing. As you've just heard, there is a limitation in capacity at a national level, although that's not being affecting us locally. But certainly my narrative continues to be, while we've got high levels of incidence, if anybody is concerned that they've been exposed to COVID, has even the mildest of symptoms, they need to be self-isolating and seeking that testing as soon as possible.
Thank you very much. That's a very good piece of clarification there, Lucy. Thank you. We move on to item number 14, which is comms and engagement update. And Sarah, are you there, Sarah? Hi.
Hi. I'll start with what has become business as usual for the time being. We're continuing to issue twice daily press releases and social media graphics publicising the location of the mobile testing units. We're grateful for the continuing support of our system colleagues in sharing these messages through their social media channels as well. The latest availability of the units is also updated online daily at the NCC website. This week's data surveillance report is due to be published today. The latest and previous reports can also be accessed on the NCC website. Our weekly press conference will go ahead as normal this afternoon. That's becoming increasingly popular. Outdoor advertising. This continues with additional adverts in Northampton, Corby and Kettering Borough, as well as on the highways rather. Outdoor bus shelter adverts in Wellingborough are ready and will be up later this week or early next week rather. We've got digital adverts going live in pub screens in Wellingborough and in Rushden, also in Corby and Kettering. We're continuing to work on new signage for Northamptonshire's bus network and bus stations with social distancing messaging, face covering reminders, etc. 700 floor stickers are being distributed to bus stations this week for exits and entrances and waiting areas in the coming days. Also on seats to remind people to socially distance while they're travelling. We've commissioned some large banners to hang outside the testing centres, which promotes testing availability and times. We continue to be intelligence-led in the communications cell, and we're doing everything we possibly can at the moment to reach the 20 to 29-year-old age group, as they account for 50% of the new cases in Corby and Kettering last week. Our social media is targeting this age group. We've also commissioned a large digital mobile screen, which will sit in Kettering and Corby town centres tonight and tomorrow. They'll display targeted messaging aimed at that particular age group. We've also commissioned something called Geolocate in Corby and Kettering. So if you're sat in a pub in either of these areas and you take out your phone to use your browser, one of our COVID-19 messages will pop up. We've been guaranteed 500,000 impressions during a 2-week period across the audiences who are in these venues. That's 500,000 in Kettering and 500,000 in Corby. So we hope to reach a large proportion of people who drink anyway, but mainly our rationale behind that was to reach the younger audience. We're continuing a leaflet drop in Kettering to targeted wards. They'll be delivered over the weekend. We've produced a specific communications pack for sports clubs, and we're working with Northampton Town Football Club and the Saints on video messaging for the 20s age group again regarding behaviours in social environments. We've compiled a list of local influencers who we're planning to contact to see if they can also support our messaging. We're also working with the University of Northampton, promoting COVID secure messages across towards their returning student population. We've prepared a series of slides which will be shown on their digital screens across the campus, and we're very much connected to them generally in preparation for that returning population. We attended a multi-agency scenario planning event yesterday as part of that preparation. We've been working with the schools cell with age-specific back-to-school COVID secure messaging. Regarding the BAME community in the county, we're continuing in our translation of videos at the moment. That's our focus. Languages currently include Arabic, Bengali, Hindi, Lithuanian, Polish, Romanian, Swahili and Urdu. And we're also planning to launch a behavioural insights survey to gather insights about what the perceived barriers to social distancing and isolation are across all communities. This information, this intelligence will feed directly into our communications messaging. And that's about it from the comms team. Happy to take any questions.
Thank you very much, Sarah. Definitely an awful lot of work going on in the comms team. So thank you very much for all your efforts. They really are appreciated. And indeed, Lucy Whiteman was on Radio 4 yesterday on the Today programme in the morning at about 10 to 7. And I have to say, she did a very, very good job with the interview and sounded fresh as fresh can be, considering the time of day that interview went out. But I would urge everyone to listen back to that interview, because actually it was very, very informative, particularly in relation to what we've been discussing today with Corby and Kettering and Wellingborough and other areas. So I would recommend that everyone had a look. Well, you can't have a look, but you can play it back. If you go to the iPlayer, I'm sure you can find it. Thank you, Sarah. So coming on to any other business, item number 15, I'm looking around the room to see if anyone has any other business. Lucy, did you have any other business today?
No, but I did want to take the opportunity to thank both our colleagues in the schools cell and also our colleagues across all partners in relation to environmental health, enforcement and communications. You know, we've still got a long way to go. Clearly, we're winning some, and then in other areas where there's still more work to do. So, you know, cases going down in Northampton, yet up in Kettering and Corby. But we've demonstrated we can do this. We've demonstrated with, you know, a significant outbreak and also community transmission in Northampton that we can get on top of it. So I just again wanted to say thank you to all the partners who are helping, and also to the public for those who are obviously trying to enforce all of the recommended actions to try and make sure they can go about their lives in a COVID safe way. It's really making a difference, and we would encourage people to continue to do so. So thank you.
Thank you, Lucy. It really is a team effort across the board, and that is the message that I think needs to go out. In which case, I'm just looking around the room if anyone has any other business. It doesn't appear so. So we come on to future meeting dates. We've got the 10th of September at 8:30 a.m. That's a bit early for everybody, I know, but Lucy has to go to another meeting soon after, so we thought we'd give it a go and start a bit earlier on that one. And then the 18th of September at 9 a.m. and the 25th of September at 9 a.m. Thank you very much, everyone. Thank you for your attending today. Thank you for your questions. As always, Lucy and your team, thank you very much for your answers and your reports. Very informative. I wish you well today, everyone. Stay safe, and let's all follow that guidance. Have a lovely day.
Thank you. Bye-bye.
Thank you.